I'm an Associate Professor of Psychobiology and Epidemiology at University College London, and my area of research is how social factors affect health. So this includes things like loneliness, social isolation, and also social, cultural and community engagement, including engagement with the arts, culture and broader heritage activities. So I run a research team where we're interested in how these different activities affect different health outcomes, including helping to prevent the incidence of mental and physical illness and helping the management or recovery for people from these conditions. And also what the mechanisms are that underlie these effects, with a particular focus on the biological mechanisms as well as the psychological, social and behavioural mechanisms. And also trying to understand how different people are affected differently from engagements, and of course what the predictors and the barriers and enablers of arts and cultural engagement are. Within my research team, we've been trying to understand how arts engagement is linked in with health across the life course. So this has included looking at general day-to-day engagement in creative activities, so things like reading, singing, playing musical instruments, engaging in arts or crafts activities, or also going to culture and heritage sites as well, and about how these organic activities, engaged in usually for pleasure, are affecting our health, including reducing our risk of developing illness or helping in the management or treatment of illness, or also helping in broader aspects of health promotion. But as well as this, we've also got a particular focus on specific interventions. So if you've got people with particular patient groups or with particular clinical conditions, how can we design very targeted arts interventions that will help to address these problems and provide very clear and specific mechanistic support in the management or treatment of these conditions? There are a number of aspects of the way that the arts are used and valued within society that can affect how they then impact on health. So one of these is about access to the arts. We know that there's a social gradient across health. People from wealthier backgrounds with higher levels of education are less likely to contract illnesses. But we also know there's a social gradient across arts participation. We know that there are certain groups, the same groups often, who are more vulnerable from a health perspective, who are less likely to engage in arts and culture. So the first key step is trying to identify how we can make the arts accessible to everybody at every point in their lives, whether through community opportunities, engagement through schools and education, and also opportunities as people move into their working life and retirement. A second factor is how we mobilise the arts and use them as an aspect of the prevention of ill health. So this is really about joining up the arts and cultural sectors with public health, looking at opportunities like social prescribing, where people can be referred by health and social care professionals through to arts activities when they're at risk of poor outcomes or when they're experiencing symptoms for things that can't just have a medical solution. And then a third aspect of this is about how we integrate the arts into secondary and tertiary healthcare. So looking at how we can identify vulnerable groups with particular health conditions and actually be able to refer them through to very targeted arts programs. So it's the same issues across all of these things around access, around opportunity, around geographically evenly spread opportunity, but most of all on collaborative working, both in terms of the sectors delivering and referring people, but also in terms of the funding opportunities. We've had thousands of research studies over the last few decades looking at how the arts affect health. But a few years ago, we noticed that a lot of these were focusing on relatively small samples, so maybe hundreds of participants. But these were often also convenience samples, so the types of people who were happy to take part in a trial on arts and health. And these often followed specific bespoke arts programs too. What we realised there was a big lack of was population scale data, looking at representative samples of people within countries, tracking them not just across weeks or months, but across years and decades to look at the long-term impact of arts engagements, but also looking at this more ubiquitous day-to-day activity. So we started working with cohort studies. Now, these are studies that track normally representative samples of people, often from birth, across every few years of their life, tracking every aspect of their behaviours, their medical records, their education, their financial and social factors, and also, often, their arts and cultural engagements. So working with 6 of these cohorts at UCL, which between them had over 300 questions on arts and cultural engagements, we've been able to carry out dozens of research studies looking at how arts participation at different times in the life course is associated long-term with health impacts, and crucially being able to explore how this differs for different population groups and how it's linked in with wider behaviours that we know are so important for people's health. Working with UK data, we've been able to show that there is a significant and meaningful association between arts and cultural engagement and a whole range of health outcomes across the life course. And we've been able to disentangle this from other determinants of health, like socioeconomic position, education, and other behaviours in people's lives. Now, of course, the critical question is, are these effects that we've seen in the UK translatable to other cultural settings, particularly ones where the arts might be valued or engaged in different ways? Now, as it happens, there are lots of these cohort studies running in many countries across the world. We've actually just embarked on a new programme of research with the US, where we're going to be trying to repeat some of these analyses, looking at the US population. Now, actually, even though the US and the UK are quite similar, we do see some key differences, in particular around what kinds of health conditions are the key challenges, and around how particular demographic factors, so things like ethnicity, race, how these are profiled differently across the two countries. Now, when we start to consider other countries, for particularly ones where we're looking at low and middle income countries, we actually do still have a number of these cohort studies available. For example, one of the cohorts we've worked in the UK is called the English Longitudinal Study of Ageing. And this tracks a representative samples of adults over the age of 50 and includes dozens of questions on arts and culture. This study actually has a sister study in Brazil called ELSI Brazil, where they've got many questions on arts and culture as well. So there are opportunities out there. But of course, the challenge is making sure you've got scientists with the right kinds of statistical and epidemiological expertise to run these analyses. And this is where I think collaboration between countries, particularly where there's opportunities to look across multiple data sets, is really key. What we're trying to do is to now develop an international platform where we can bring together cohort studies from different countries and actually start to compare the findings cross-nationally. So we're working on this with the World Health Organization and are hoping to be releasing more information about this later in 2020. This will give us an opportunity to map what kinds of cohorts are available in different countries and what kinds of research questions they've got on arts and culture and also on health and social outcomes, and also allow us to start mapping opportunities for collaborating with other epidemiologists and teams in these different countries. Because if we start to see the same findings across multiple data sets, so in other words, across multiple different cultural contexts, then this really starts to strengthen our confidence in the links between arts and different health outcomes. The samples that we've been working with in the UK have ranged from a few thousand to tens of thousands of participants, and they've been tracking people from anywhere between 2 years and 70 years. So we've got a remarkable amount of data here, and particularly data that's allowing us to do this long-term tracking. And this is vital because a lot of the ways that we think the arts affect us are not necessarily short-term. We often talk about the short-term impact, but there's also a lot of research that suggests that, for example, engagement in the arts as a child could still be having effects even years or decades down the line. And this is what these cohort studies allow us to explore. Instead of us having to start now and wait decades until we can look at the outcomes, we can go back retrospectively and look at people who were born in the 1940s, 50s and 60s. We can see how their childhood arts engagement is linked in with what's happening to them in their health now in the 21st century. Across 2018 and 2019, I worked with the World Health Organization on a report which looked at what the evidence is for the links between arts and cultural engagement and health outcomes. And we reviewed the findings from over 3,000 studies, which showed a remarkable amount of data on how the arts affect us. Now, some of these effects were seen in terms of broader determinants of health and health promotion. So, for example, we were finding that engagement in the arts was associated with differences such as higher understanding of different types of health conditions. The arts could be playing a role in things like health communication. They could be helping to reduce stigma around health conditions and playing a role in supporting health and social care workers. But we also looked at how they could actually help in the prevention and management of illness. And what we found here was that at different stages of the life course, we see different effects on people's mental and physical health. So, for example, in early years, we find that the arts can actually help with things such as the management of premature birth. Infants who listen to music are likely to gain weight faster and be able to leave hospital sooner through reductions in physiological stress whilst being in intensive care settings. We see that the arts can help with things such as speech and language development and play a role in supporting children's education. We also find that the arts across childhood and adolescence and into adulthood are associated with better mental health. So, for example, a lower risk of developing depression or anxiety, and better management of these conditions when they do occur. We're also finding increasing evidence about how arts engagement is linked in with healthier living. We find that people who engage in the arts are also more likely to engage in other health-promoting behaviours, and they're less likely to engage in risky behaviours, whether risky sexual behaviours or behaviours such as alcohol and drug use. We also see that engagement in the arts can be linked via different biological pathways with things like inflammation, stress hormones, and that these then link through to the risk of developing conditions like cardiovascular disease. As people age, we start to see more associations with healthy aging. So, for example, engaging in things like dance is associated with better bone strength, better physical fitness. We see engagement in broad arts and cultural activities associated with a lower incidence of frailty and a slower progression of frailty. There are lots of associations between the arts and better cognitive functioning. Slower rates of cognitive decline have even been proposed. And we also find that people who develop dementia are actually better able to manage their dementia symptoms and also likely to have a higher quality of life. There's also a crucial role for the arts in end-of-life care and in bereavement. And if we zoom back out again, we're also finding that the arts have a really important role within society in terms of supporting social bonding, reducing loneliness, helping with social cohesion. We see this on small scales with individuals or small groups, but also at a larger societal level where there's evidence about how the arts can help in things like conflict between different groups. And there's also interesting emerging evidence on health and social inequalities and about how the arts can be used to try and provide opportunities for individuals who might be considered normally more at risk for health and social challenges across the life course. So altogether, this data paints a very rich picture about the role that the arts can play. And crucially, it seems that the arts don't have just one or two different mechanisms by which they affect us. We've mapped over 600 different mechanisms, including psychological, biological, social and behavioural pathways by which the arts are linked with these different mental and physical health outcomes. Historically, one of the key ways that children have engaged in the arts is via schools. And this is really important because we know that when children engage in the arts, they're much more likely to then continue to engage in the arts as adults. But what we've actually found is that another reason that school engagement in the arts is so critical is because we actually know that if we look at arts engagement outside of school settings, there can be quite a strong social gradient. In other words, it really depends on children's parents and families as to whether the children will engage in the arts outside of school. This is driven primarily by things such as previous arts experience from parents themselves, but also things like economic circumstances. However, within schools, this is a perfect opportunity to level the playing field and make sure that all children have access. And in the UK, when we look back a couple of decades ago, we find that there's been very little difference or no difference at all in arts engagement in school settings, despite these clear differences outside of school. Now, of course, the challenge is that in the last decade, across many countries, there's been a deprioritisation of the arts within schools. They've often been seen as a nice addition, but it's very much secondary to core subjects such as art, science, English or core language and maths. And of course, the challenge here is that if the arts aren't part of a core curriculum, then they're often not something that's made easily available or equally available to children. And it can then come down very much to each school individually. But it's also important because there's so much evidence of the benefits of arts for children in terms of their educational opportunities, their behaviours within schools, but fundamentally also their own mental health. The arts seem to teach children the abilities to manage things like self-esteem, to support coping mechanisms with emotions, and to support social bonding processes and the formation of friendships and social networks. So moving forwards, I think it's really important that we make sure that the arts are prioritised within schools for all of these reasons, and crucially, that access within schools is completely equal and that we don't accidentally end up with any kind of social gradient that might exacerbate the differences in arts participation, but also the differences in health and social inequalities. Over the last few months, I've been leading the UK's major study into the psychological and social impacts of the COVID-19 pandemic. So we've been tracking over 70,000 adults in the UK who've been completing surveys for us every week. So we have over 500,000 completed surveys over 15 weeks. And we've been looking at this in order to see how people's experiences are changing, but also how different behaviours are affecting people's outcomes. And one of the fascinating things that's coming through is that arts engagement is being linked in very much with mental health across this period. So people who are engaging more in reading fiction, listening to music, arts and crafts hobbies, these people have been having lower levels of depression and anxiety. And we're seeing the direction of this association as well. So people who take up a new hobby across lockdown have then been able to reduce their levels of anxiety and depression and increase their levels of well-being. Now, this is fundamental because actually this is a time when many of people's usual coping resources have been stripped away. So things like the arts that can be engaged in from home are more important than ever. We've heard anecdotally from past very challenging circumstances like world wars about the important role the arts have played and the prioritization they've had within society. But we're now seeing that firsthand. When we see the viral videos from Italy in the early days of lockdown, people were singing from balconies, and this is what was being shown most on social media. But there are also some more things that are coming out from our data. We're actually finding that 1 in 5 adults in the UK have been doing more arts activities than normal across lockdown. And interestingly, some of these people turning to the arts are people who are facing adversity such as job losses, which is really promising as it suggests this is actually people who need more coping resources who are choosing to engage in the arts. We're finding in particular that the arts are playing a role in helping to distract people from stresses and worries in their day-to-day life. But they're also helping to build people to build up their own confidence and self-esteem at the moment. And they're helping people to have the time and space to focus on what's worrying them and to reappraise difficult situations and even to vent their negative emotions and frustrations. But the real challenge is that in many countries, the reopening of arts and cultural venues is not being prioritised. Now, of course, there are challenges around this in terms of managing the virus, but we're often finding that other places, such as restaurants and bars, are being prioritised above and beyond the arts and cultural sector. Now, one of the reasons this is so worrying is because people might not be able to have access to their coping resources. But in fact, the reason that's even more worrying is that so many arts and cultural organisations are very worried financially about what the pandemic is going to do to their ability to function in the future. And of course, if we start to have arts and cultural organisations shutting, we're not going to have these kinds of assets and resources available to people. And we're likely to actually see that there's an impact from this on mental and physical health over the coming months and years. Therefore, it's really important that we keep monitoring how the arts are affecting people and particularly who is engaging, trying to reduce some of these inequalities in opportunities to engage in the arts, but also that we're working to support the arts and cultural sector to make sure that they are able to continue providing support to individuals. I think that key considerations for policymakers include trying to make sure that the arts are freely available to people equally across society. So this includes making sure we've got opportunities within schools, within communities, and also making sure that there are opportunities for older adults, for example, in nursing and care home settings as well. A second consideration is trying to support collaboration between the arts and cultural sectors and also with health and social care. So this might involve things like joint funding opportunities for initiatives that will cross between both. It might involve partnership work for things like social prescribing schemes so that it's possible to develop proper referral lines between these different settings. A third thing that we have to consider is about making sure that we prioritise effective interventions and get them running in practice, and particularly making sure that there are opportunities for the funding of these to go beyond mere short-term projects. Otherwise, so much work is lost and not capitalised on. And I think a fourth thing is investing in research on this. We've got so much research that's happening in different places, but the main limiting factor is often funding for this research, and especially, again, the long-term investments, so that we're able to look at some of these much more important large-scale research questions, such as the population level impact. Now, this can be achieved if we ensure that questions on arts and culture are prioritised within national cohort studies and population studies. But this, of course, involves money to make sure those questions can be implemented. So I think it's this connection across funding, across research, and across the practice and the collaboration between sectors that's so crucial. Because in essence, if we have more people engaging in the arts more equally across the life course, then we're likely to have better health and social outcomes at a population level.